Hi, I'm Dr. Derek Garcia, and I'm here to talk to you today about adjusting infants, children, and adolescents. And I know a lot of people out there, when they hear this, they get a little bit taken aback and are slightly appalled by the fact that we would dare to adjust infants. And if an infant adjustment looked like an adjustment we gave a regular adult, I would absolutely agree. That would be appalling. But fortunately, we can modify the depth and the force of our adjustment based on the age and frailty of the person in front of us. Oftentimes, an adjustment for an infant is more of a sustained contact and a little bit of overpressure more than a gross motor movement we're used to seeing in an adult adjustment. Especially in the neck, we can come up, we can find an area of rapport, an area that needs to be worked with, and we just put our finger on there, do a little bit of wiggling, and just letting the baby's body acknowledge what's going on here. And in the lower spine, oftentimes it's as simple as putting a little bit of pumping action in the lower back and hips with a little bit of added overpressure, and that gets the job done. Oftentimes we don't even hear the pop that you're used to hearing, which we call cavitation, with infant adjusting. And even when we start adjusting adolescents and adding a little bit more force, it's a little bit more commonplace to hear the pop or the crack, but it's still not very common. And so now that we have that cleared up, let's get into some reasons why an infant might be adjusted. I've personally never witnessed a birth, but I've seen a few videos and I've done some research on the methodologies used to deliver babies, and sometimes it can be a little bit traumatic. I mean, there's the actual forceful pulling with the pushing in a natural birth, and sometimes it's so difficult that they go and grab some forceps and use those to assist. Not to mention that a baby can come out in an improper position, foot first, arm first, or even with the cord wrapped around the baby's neck when they're delivered. And all of these can lead to birth traumas that need attention. If we look at a C-section, which is, not becoming more and more prevalent in the birthing process, you don't have the assistance of the natural push that the mother would be using in the more common and natural birth. And so there's a little bit more force required as you're pulling the baby out. Not to mention, this baby has been sitting in a very safe, controlled, and protected environment inside of the womb, and all of a sudden it's getting thrust into this new hostile environment we call planet Earth. So, along with these birth traumas that very likely can occur in the birthing process, what else is an adjustment for with an infant? We've seen improvement with latching, with colic, increased amounts of sleep, and decreased amounts of crying just from a baby getting adjusted. Now, this helps a baby live and thrive and grow, as well as helping the parents minimize stress and actually increase the amount of sleep they're able to get if their baby's sleeping for longer periods of time. And I think most new parents can agree that that's a pretty good thing. And as we move into the older toddler and adolescent years, we can see here there's a little bit more of a physical demand for an adjustment. See that it's a very light touch and very non-traditional in the sense of an adult adjustment. And when toddlers start growing up, they start to move around, they start to crawl, start to walk, which inevitably means there's going to be more falls, bumps, bruises, and accidents along the way. And, through this we can see why, or at least become more aware of how a child could get out of alignment or even start to lose its proper balance of tone in its body through these falls and accidents. With toddlers and adolescents, we've seen an improvement in allergies and chronic ear infections, asthma, and even digestive issues like irritable bowel syndrome. And I'd like to take a step back real quick for a second and just clarify that all these aforementioned symptoms and diseases are not necessarily going to be healed miraculously through chiropractic. If the reason these symptoms are appearing is due to nervous system interference, then yes, chiropractic can absolutely help, but there's no guarantee that any of these things will get cleared up with an adjustment. As the children progress to their older years, they start to get in more physically demanding adventures, they start to get in sports, they're sitting in desks for longer periods of time without opportunities like recess to get up and move around, and so we start to see a little bit more of a need for adjustments. Another big issue with the teenage population is the infamous text neck in the technologically driven society of today, which can actually result in a reversal of the neck curvature. So all of these things, including the body's ossification process, which essentially is just the bones hardening. They start out as a cartilage matrix when we're born, and then over time start to turn into full bone. And I like to relate this a little bit to the process of concrete hardening, because when you initially pour the concrete, it's very movable, very malleable, and shapeable. But then after a few hours, and especially after a few days, you can't even move it. I mean, you need a jackhammer to do anything to it. And so if we can get in and help influence any structural issues that a child's having before their bones begin to ossify, then it's a huge amount of help and helps prevent any long-term disability, chronic pain, or things like scoliosis from progressing too far.